Normally, to maintain the balance for any person, you require inputs from eyes, you require inputs from the ears, and also from the nervous system from the extremities like legs and hands. Suppose you have any impairment in this, in the ear, the inner ear is responsible to maintain the balance. Suppose the inputs to the central nervous system is impaired because of the impairment because of the problem in the inner ear, or you have a vision problems, or the nervous system which carries the position of your legs and hands, if there is any impairment in diseases like diabetes, you may have a problem in balance. Brain, especially the cerebellum part, which is a wonderful coordinator from all these three systems, will do the coordination. So if there is a lack of input from any one of these, or if the patient has a problem in the cerebellum also, there won't be proper coordination. Hence, these people can have problems. So any person who have a problem in the balance, they should be thoroughly examined, like eyesight checkup and also ear examination. And there are some special tests, what we call it as a maneuvers we do in the OPD. And also we should see the peripheral nervous system, means the nervous system is intact or not, or any symptoms like neuropathy are there. In some diseases like diabetes or vasculitis, when there is a neuropathy is there, they can have a loss of balance. And also, if there is a problem in the cerebellum, in the brain also, you can have a problem. That is the reason when you have a problem in the balance, please see the neurologist, consult him and have a thorough examination so that you can prevent from falling, and also you can get proper treatment, including physiotherapy also may help you sometimes.
Like, comment and subscribe for more health updates.